Greetings from Geneva. My name is Tony Consul. I'm the head of communications here at IATA. Today I'm joined by three of my colleagues, Alexandre Juniac, who's our Director General and Chief Executive Officer, Brian Pearce, who's our Chief Economist, and Dr. David Powell, who's our Medical Advisor. Brian and Alexandre are here in Geneva. David is joining us from Auckland, New Zealand. Today, what we'd like to do is to address one of the issues that has been circulating or coming out of this crisis, which is what to do on board the aircraft when the industry is ready to ramp up its operations in the post-pandemic period. To help us do that, Brian Pearce has done some economic analysis of what proposals to leave the middle seat empty might result in. And David, Dr. Powell, will then discuss some of the medical aspects of why we as an association are not recommending to leave the middle seat open. After those two brief presentations, we'll throw it open to questions, and Alexandre, Brian, and David are here to answer questions on this issue or any other issue with respect to the COVID-19 crisis. So with that, I'll turn it over to Brian to start us off.
Thank you very much. Give me a second. Thank you very much, Tony, and good afternoon, good morning, everybody. I'm setting the discussion here about the middle seat issue within the context of looking at the question of as we move into the restart, as lockdowns and borders start to open, will airfares be low or high? Because typically, after a crisis, airlines will set fares low to stimulate demand. And indeed, on the left-hand side, you'll see a number of reasons why that will be the case. What's different this time is that the cost of providing air services could be considerably higher than they would otherwise be as a result of some of the restrictions that are some necessary, some being imposed, including, of course, some requirements for social distancing on board aircraft, and we will focus on that. But let me start with why we think that in the beginning we will see significant downward pressure on fares. I think the first reason is that we would expect to see demand to be relatively weak as borders and restrictions open up. And I mean, just looking at the example of the opening up of the Chinese domestic market, which you can see bookings in the green line here, that started as the number of COVID cases fell towards zero, as you can see from the green bars. And indeed, we're seeing similar trends in those cases, particularly in Europe, as you can see from the blue bars, and in the United States, which is a little bit behind. At the moment, as you can see, bookings are there are no bookings in the EU and the US at the moment. There has been an improvement in China, as you can see, because of the return to work and some VFR traffic. But as you can see, it's been relatively weak, and bookings in China's domestic market are still 2/3 down on where they were last year. The second reason for thinking that fares will be low is there's a lot of overcapacity. There's a lot of aircraft that will be potentially chasing relatively few passengers as the market opens. Now, airlines have parked much of their fleet. As you can see, the in-service fleet has more or less halved in recent months, from just over 25,000 aircraft to just over 13,000. And correspondingly, the number of aircraft that have been parked or in storage has risen to over 16,000. Now, because for the most part, these are very expensive assets with fixed obligations to pay, clearly there'll be an incentive to deploy them at any opportunity. So we think there is substantial potential for overcapacity as a result. But not only that, I think potentially also there's very strong competitive pressure on really most routes. Although there are a lot of routes with just one carrier, they tend to be very small markets. And if you look at the right-hand bar, over 80% of seats globally are flown on routes where there are two or more airlines. In fact, 60% of seats are flown on routes where there are three or more airlines. So, despite the consolidation that we saw before the crisis, and despite the consolidation which we think is likely after, we still think that there's going to be substantial competition on most routes. And then the fourth reason for expecting fares to be low is, of course, that we've seen fuel prices fall to very low levels. This shows the price of oil, Brent crude oil, down at just over $20 a barrel today. Jet fuel is pricing at a similar level, actually slightly below the price for Brent crude at the moment. Jet fuel costs about $20 a barrel at the moment. And as you can see, that's down, around about a third from where it was pre-crisis. This is a major variable cost. So consequently, all of that adding together, we think will mean low fares. And indeed, that's what we've seen in the Chinese domestic market. As you can see here, blue bars show bookings, which are up, which have more or less doubled from the low point, but as you can see, they're still considerably down from where they were. Chinese airlines have been working hard to stimulate that demand. As you can see, the average domestic fare is down over 40% as a result. So that's our expectation. At the start of the restart, it's going to be a low fare environment as airlines try to stimulate demand from consumers who are fairly cautious. Now, that's a problem if we have the requirement for social distancing, or rather the removal of the middle seat, as you can see from this narrow-bodied aircraft, a typical three-seat configuration from narrow-bodied aircraft. If that happens, as we're seeing some governments push, that means that there's a maximum of 67% of those seats on the aircraft that are available for sale. And if we look at what break-even load factors were last year, as you can see, no region at all would have made money at the EBIT or operating level at a maximum 67%. And of course, that's the maximum proportion of seats that could be sold. It's unlikely that airlines would be able to fill all of those seats for obvious reasons. But not only that, the narrow-bodied seat configuration is not the only one. And if we looked across wide-bodied, regional jets, turboprops, and the requirement for removing seats in between passengers in those seat configurations actually removes even more capacity from those aircraft models. And so if we sort of average that across the fleet, that would mean basically only 62% of seats on aircraft on average would be available for sale. And there are some illustrative numbers at the bottom there to show the impact this would have on unit costs. There's a very significant increase in unit costs as a result. But the other point is that just looking at all of the airlines in the sample that we have, and that's over 120 airlines, looking at their break-even load factors last year, and that's break-even, as I say, at the EBIT or operating level. Only 4 of those airlines would have made money if they'd have managed to achieve fill all those seats at a 62% load factor. And those are actually very small specialized airlines. A couple of them are charter airlines. The majority of airlines would not have been able to make money at that sort of load factor last year. So we had a look at what that 62% constraint would mean if airlines were just to try to break even, i.e. make no profits at an operating level. And that's quite a restrictive assumption because airlines have still got to pay interest on their debt. We've assumed that they actually wouldn't be able to fill all of those available seats, so we've assumed an 85% load factor on those available seats. And you can see that in order just to break even, fares or the average yield would have to rise between 43 and 54% just to break even. So as we said at the beginning, the likelihood is that in the early stages of recovery, fares will be low because of low fuel prices, because of excess capacity, because of weak demand. Airlines will need to try to stimulate demand. The trouble is, if we do have these restrictions on middle seats, that will mean a very substantial increase in unit costs. And without the ability to pass on those costs in higher fares, which is unlikely to be the case in the early stages, I think it's just going to mean that many airlines, many operations are just going to really struggle to be financially viable. In the longer term, once we see demand rebounding to stronger levels, and there's some pricing power in the market, if these restrictions are persistent, then that implies that the cost of air travel will be significantly higher than we've seen before. And I'll leave it there. Thank you very much.
Great. Thank you very much, Brian. Now, what I'd like to do is to call on Dr. Powell, who will present very briefly some of the proposals that we've been making to governments on what we think should be done on board the aircraft. So with that, David, I'll turn it over to you.
Thank you, Tony, and hello, everybody. Thanks for the chance to just talk through this. So, of course, we all know that the virus has been a passenger on our passengers, and that's been the way, for the most part, that it's spread around the world. But that's a separate question, actually, from the one about what is the risk of transmitting from one person to another in flight. And that's been an interesting question to try and explore. So let me just, first of all, review what there is in terms of published scientific literature on that. Not a lot, but there early on in the piece was a case report relating to the very first flight, very first case in Canada. And on that case, there was extensive follow-up of all the passengers nearby that person when it was discovered that they'd flown when starting to be unwell. So they followed up 25 nearby passengers and somebody who had close contact in the airport and all of the crew, and there was no transmission to any of those people. They were tested negative. If we fast forward to really quite recently, there was a flight, China Airlines 11 from New York to Taipei. This was a repatriation flight, so large numbers of people travelled, 340, I think, on board. And it turned out subsequently that a number of them had flown while unwell. Others still began to test positive in the few days after the flight. And so the authorities, as you know, Taiwan's been very, very active with contact tracing. They followed up all of those passengers on board, the entire passenger list, and none other than those who were already unwell or becoming unwell at the time of flight tested positive. So there's no evidence of transmission to any of the other passengers in flight. More recently, there's one pre-publication from China that really presents no information. It just says that they believe there was transmission in flight, but no information's provided to support that. And the fourth one's a very interesting one, relating to a pair of flights on a triangular journey from France and into Africa. The author's conclusion is that they think transmission occurred from one passenger to an unrelated passenger, but their assumption depends on relying on the fact that there were no reported cases in the destination country, Central African Republic, at the time. They place a lot of value on that, but given that we're now seeing examples from post-mortems where, in fact, there were probably cases before the first reported cases in a number of countries, that's probably a questionable assumption. If we move on to our own experience, we have regular contact with about 70 airlines in terms of their medical contacts, and closer contacts still with a smaller number of those. And we surveyed them to try and find out if they knew from interacting with their public health authorities about follow-up of passengers who turned out to have become cases after flying. And we were able to get very detailed information from 18 airlines that represent about 14% of global traffic through these months, January, February, March. And from all of those, we have about 3 instances where it's suspected that there was transmission in flight from, I'm sorry, I've written that the wrong way around, from a passenger to a crew member. So just to be clear, that's 3 instances of transmission from passenger to crew member. And 4 where there's transmission possibly from pilot to pilot, but that could be pre-flight, in-flight, or even post-flight on layover. But none from that exercise of any of those airlines had cases that they felt was from passenger to passenger transmission. We went just in a little more detail with 4 of those airlines who had close relationships with their public health authorities, and we were able to follow up 1,100 confirmed cases post-flight. And those flights that were involved in those 1,100 cases were well over 100,000 passengers. And again, no secondary cases amongst other passengers, just 2 of, again, possible passenger to crew transmission. So compare that with, close household contacts. I'm looking at a report here that says that it's about 7% of close household contacts who get secondary cases despite the best protection. So if you compare that experience that we're seeing, the risk appears to be low, and that raises the question, why might that be? What's different about an airliner from another environment where people are close together? Well, people don't sit face to face. They all face the same direction, and the rows are separated by a significant physical barrier at the seats. And they also sit still. They don't tend to move around a lot during the flight. So that's a difference from some other settings. And also, I think it's been so well publicised during the outbreak that from the early days, people have really avoided travelling when unwell for fear of getting stuck somewhere or into trouble. And the message certainly got across about them avoiding touching each other and surfaces, and covering their cough and hand washing. So that could be something to do with it as well. But the other important thing is that in the in-flight environment, we have a high airflow. So the flow rates in an airliner cabin are around 10 times what they are in a typical office building. And it's very controlled sort of airflow, so there's very little forward to aft flow of air. It tends to be in a cross-sectional direction. And of course the air that's entering the cabin is highly filtered through HEPA filters. So those are possible reasons for that risk to be as low as we're observing it to be. But we are proposing a layered approach of many protections to allow safe travel as soon as that's possible. So part of that is reducing the risk of people travelling while unwell. So that's through screening prior to travel, which could include symptom screening, inquiring about recent contacts, and temperature screening, which has a lot of limitations, but it did catch a number of cases early on in this outbreak. And of course, the measures to minimise close contact with other people at all stages of the journey, particularly in the airports with the check-in and baggage, the boarding process will need to be controlled so that people are not mixing, and particularly not face-to-face. We'll be continuing, obviously, to urge meticulous hand hygiene and cleaning procedures. And because physical distancing is so difficult to achieve, as an added layer of protection, literally, we would be advocating face coverings for passengers and masks for the crew, just as are already coming into being in the US and Canada and Europe, already were in China and so on. And there are similar protections to all of the above that relate to the crew themselves. And we would advocate that by adding the in-flight measures, which include not only the boarding process, but limiting motion within the cabin during the flight, some sort of control over how the bathrooms are used, in other words, one at a time, and the simplified catering procedures, which we're already seeing, that these measures altogether would enable us to be able to continue or resume operations without needing to try and achieve the physical distancing. So that's all I had.
Great, thank you very much, David. With that, I'm happy to open it up to questions. I see that we have some already in the Q&A function. If you have questions, I encourage you to type them in, and we will get through as many as we can between now and 2 o'clock. So the first question we have is not about the social distancing on the aircraft, but more about consolidation. Are we predicting consolidation, and at what level do we see that?
Well, I think it's likely that we will see that because of the unprecedented size of the shock that has been delivered to airlines. It's massive loss of revenues and grounding of many businesses. Obviously, governments are, and we're actively engaging with governments to get support, as other industries are doing the same. And governments have been providing financial relief and operational relief of some sort, which will help because in the past we've pointed out that airlines have got very little liquidity. This has obviously been provided to some extent by government support, and some airlines have been going out and raising money from banks and the capital markets where they can. But I think a lot of airlines will not be able to do this, and we've actually started to see some bankruptcies, some failures of airlines. So I think the consolidation process effectively has already started.
Okay, thank you very much, Brian. We have another question asking about face masks. And do we believe that will become a long-term measure amongst airlines?
That's interesting. Of course, I think the intention is that that sort of protection would be just when this virus is circulating widely in various communities. That may be with us for some time. And so simply this virus on its own may necessitate that sort of change in our behaviour for a while to come. But on top of that, there's also the chance that people's expectations over how we interact socially in lots of public places might change permanently thereafter. So it's possible that could be something that stays with us long term, but I don't profess to know.
Great, thank you, David. Yes, and I think our general position is that these are temporary measures that would need to be reviewed regularly and aligned with either new developments in technology or medical science. So we have another question, which is asking about business and first class passengers. What type of social distancing would we expect to see in those premium classes? And what proportion of an airline's profit is normally made from premium classes? So, Brian, maybe you want to take the first question?
Yes, that's right. I mean, I think that is going to be a challenge for many airlines, because I think that that segment of the business is going to be hit. It will be smaller, I think, than it has been before. I think there'll be some effect from the video conferencing everyone's got used to. There'll certainly be an effect from the recession, which is, we know is going to be extremely deep. Companies will be cutting back on corporate travel as a result of that. For the network airlines, those flying on premium seats typically generate much of the profit. So I think we're going to be seeing some changes, and certainly across the fleet there'll be more economy seats as a rising proportion. I would think, but yes, to allow for the correct the distancing in the premium cabins, that will mean a disproportionate reduction in average revenues for airlines.
Great. We have a question looking a little bit further along and asking if we have any forecasts for 2021, either in terms of traffic or profits. And is it possible that the industry could turn a profit in 2021?
I think that would look very challenging. We haven't published any figures on that, but certainly I think our thinking at the moment is that while the global economy, if we look at many forecasts, many economic forecasters are suggesting that in the second half perhaps of 2021 we'll see pre-crisis levels of economic activity restored, and that might be true with domestic travel, although the Chinese domestic market has certainly been very slow to recover. It won't be true, I think, for international travel unless we have a vaccine by that time. So I think we would expect 2021 to still be recovering, but at a relatively lower level than we would have previously expected. And can airlines make a profit in those in that environment? Well, I think the presentation today has really been making the point that given that in the early stages, and 2021 will probably still be a period where airlines will be trying to stimulate demand, and there'll still be a lot of capacity around in terms of unused aircraft, so fares are still likely to be relatively low. So if we have the requirement for removing available seats on aircraft, it's unlikely that airlines would be able to make profits, or at least the industry as a whole.
Okay, thank you, Ryan. We have a couple of clarification questions on our position with respect to the middle seat. So maybe, Alexandre, these are for you. Is IATA's official position that the middle seat should not be required to be left empty? And what does that mean with respect to what airlines will eventually do? Are they required to comply with that, or will they consider it and use their own judgment with respect to their individual markets?
So for the moment, the IATA is advocating in favor of first having a multi-layer approach for health checking and sanitary control for passengers, provided we have this multi-layer approach, accumulating, health declaration, temperature control, mask distribution, with probably an obligation to wear it on board, we think, and relying on the studies that have been very well explained by Dr. Powell, that there is no need to neutralize the central seat. That's the first point. So it is a position that is strictly linked with the implementation of robust and safe health and control process for passengers. So that's the first point. The second element is that it is not mandatory for the airlines at this moment. They are, as you have seen, there are different rules applied by the airlines all around the world. What we are doing is that we have launched a discussion within ICAO with government and with international organizations such as ICAO, of course, but also WHO, to determine what is the appropriate health and control measure. And so if it leads to a guideline or even a procedure that is issued by ICAO, it will be applicable to all countries, but it is not now. If it happens, it will be probably in the coming weeks, at best probably in June. Then it could be mandatory. We are also trying to convince government, to discuss with governments about the appropriate health sanitary control process that has to be put in place to travel safely, knowing that, as you know, safety and health safety in particular is the number one priority of airlines and of IATA. There is no compromise on safety.
Great, thank you very much, Alexandre. We have a question about what airports are doing. The question says that airports are raising concerns about the lack of space to do social distancing at boarding and immigration. The queues would be too long if they did that. What coordination are we doing with airports in order to resolve this and have a unified approach?
It's a complete and full coordination. We are working in the group I was mentioning within ICAO, with WHO. We are working with ACI, so the Airport Council International, representing the airport, in a full and complete transparency and coordination, because we think that it's a continuous process that starts probably at home or at your office when you book, and that ends when you go out of the airport or the arrival at the airport. So it has to include all the members of this journey, of this chain, to be effective, efficient, and safe. So we are working totally closely and in full cooperation with airports, especially on this question of social distancing on the ground.
We have another question on the same general topic, asking if national and international health authorities have concurred with our assessment of risk, or is that an ongoing discussion? Please.
I'm sure we were going to say the same thing, Alexandre. It's an ongoing discussion, and there's WHO, a part of the same multi-party working group with ICAO and ACI and ourselves, and we are in regular contact with WHO anyway. So yeah, Alexandre, over to you.
Yeah, exactly the same. Nothing to add. It's an ongoing discussion, and we hope to conclude that discussion by within 2 weeks.
Okay. We have a question on the situation in France. It says that the French government has requested Air France to significantly reduce domestic travel on some routes. Is it favorable in IATA's view to reduce domestic capacity in any country in exchange for a government-backed loan or bailout?
No, but it's an old idea that has popped up some years ago, to limit short-haul flights when there is a railway route existing. So we have seen that the French government has recommended that short-haul aircraft being reduced when there is an equivalent by train. I think that is a point on which the air transport and the railway have to organize themselves to offer the best service and the most open service to passengers. I wouldn't recommend government to dive in this type of subjects, which is the responsibility of the various transportation companies.
Okay. We have a question on Brian's analysis. If airlines are under pressure, airfares go down and costs increase, the question is, what will the result of that be?
Let me just tackle that first. I think it's going to mean that in their existing form, many airlines will really struggle to be able to conduct financially viable operations. This is a high fixed cost business, which really depends, making money just to repay your interest on debt or pay shareholders a normal rate of return requires on very high utilization rates, both in terms of keeping aircraft up in the air and also filling the seats. And both of those factors are likely to be very difficult to achieve, particularly if there's a requirement to remove the middle seat. So, it's going to be it would have to be a much smaller industry. It'd be, as I say, it's quite tricky to understand how many airlines would be able to operate profitably in that sort of environment.
Okay. We have a question on our overall recommendations. Do any countries or airlines already have procedures in place that you think could serve as a model for others? And if so, which ones are they?
For the moment, we see several experiments that are done by airlines, but what they are doing now is experiencing. We see that they are requesting sometimes to put masks, sometimes to neutralize some seats. In terms of catering distribution, we have seen some also requests in terms of disinfection and sanitizing as well. So we are in an experiment phase, and I don't think that anybody and any airline would recommend their process as a model. It's much too early, and everybody is expecting that the ICAO work group and that IATA would be able to propose something common, recognized, and safe. So no model existing on this planet, and what we think is that everybody has to be modest, waiting for the international body to do their job.
Okay. We have a question, David, I believe, on the studies that you spoke about. The question says, what is the process for contact tracing for ill passengers? How long after the flight were fellow passengers notified? Is there a possibility that they became ill later and airlines would not have that information?
So the process typically is that somebody has arrived has flown somebody somewhere, and then they've become unwell. They're identified as a case, so they get followed up by the public health authority, and then it becomes obvious that they flew recently. So the public health authority approaches the airline and asks for contact details for passengers in the same area of the aircraft as the original case, and they all get followed up and tested. So that's the process typically, and that was certainly the type of process for those 1,100 examples that I mentioned. So for those 4 airlines that we chose them because they had a very reliable and close contact with the public health authority in their country. In some countries, it's less reliable, and the airlines are simply required to give a passenger list to the public health authorities, and they don't necessarily hear what happens in the follow-up. And so in those cases, we weren't able to be quite so clear about secondary cases. But I would add that I spoke with US CDC early on in the process, who again confirmed they did not, their experience was that they were not seeing chains of transmission related to flights.
Okay, thank you, David. I think this is another question for you. On the flights that were examined, did we also look at load factors, and particularly whether those were above the 2/3 or the 67% mark?
Yeah, very fair question. But most of these instances that we're talking about occurred in February and March. So not so much in January, of course, there weren't so many cases around flying. February and March is when all this occurred, and then late in March, the bottom fell out of the airline business, so there really wasn't the number of passengers. So these were when load factors were normal.
We know, just if I can add, we know in March the average passenger load factor across the industry during that month was 60%.
Okay. Great, thank you both. We have a very practical question. If our recommendation is to require people to wear masks on flights, including long-distance flights, how would they be able to eat and drink? Would they be able to remove their masks for that?
Yeah, and it's an important consideration, one that's been picked up in discussions with ICAO and other organisations in respect to the flight deck, actually. So currently on cargo flights, there are some operators who are having pilots wearing masks, or there are flights currently where the cabin crew are wearing masks. What happens if they are eating a meal next to each other? So they have to kind of alternate removing the mask and eating the meal. And there'll probably need to be some sort of similar control over that in the passenger cabin as well. So ideally you wouldn't have two adjacent passengers uncovered at the same time for obvious reasons.
We have a question about sort of our historical approach to this. The question says that in April, on April 14th, we said that leaving the middle seat vacant was likely to be among the conditions that regulators set for air travel. Now we're suggesting something different from the industry side. What has the discussion been like in the interim period?
First of all, the discussion has just started a few days ago. That's the first point. Second point, when we have indicated that some regulators wanted to neutralize the middle seat, because it was what was popping up from some regulators that were experimenting some methodology to restart their traffic. But of course, as we have the discussion with the regulators, we have been able to show our studies. Everybody has worked. The aircraft manufacturers, they have also produced some materials to explain the ventilation and air conditioning system. So things have moved forward based on more fruitful and solid discussions and on more scientific or technical evidence provided by all parties around the table. So it explains why things have evolved. It's not surprising. It is a produce of rigorous and fruitful discussion between informed parties.
Okay, thank you. We have a question about what's going on in China. Are the domestic companies in China adopting physical distancing? Or if not, what are they doing? What processes are they implementing to avoid contagion?
What we have seen in China is that to restart the domestic traffic in a period in which the demand was pretty low. The first rule proposed by authorities, at least for social distancing on board, was to have a maximum load factor around 75%, which was already the case because planes are not full at all. So it was not difficult to implement. We understood that it was also a temporary measure when China was just reopening its market and reopening domestic traffic. But as with many countries, we are discussing with the Chinese authorities about what would be a more permanent rule in terms of loading the passenger aircraft.
Okay, thank you. We have an update question on the industry's revenue losses. Do we have any updated figure on our last forecast for that?
No, I think the last forecast where we were expecting passenger revenues to be sort of more than 314 billion lower than 2019, and passenger traffic down, almost by a half in 2020 on average. Looks about right at the moment. I mean, obviously, what it will depend upon is this: as once lockdowns and travel restrictions start to be eased, the strength of the return, the strength of the return in demand, and the ability of airlines to respond to that. So no changes in those estimates at the moment.
Okay. We have a challenging question which asks, how would we respond to the suggestion that recommending not to block the middle seat is unduly motivated with financial considerations and not safety considerations?
It is clear that the neutralization of the middle seat, as Brian has clearly demonstrated, has an enormous financial and operational impact on airlines. Additionally, what Dr. Powell has also demonstrated is that neutralizing the middle seat brings no additional guarantee of safety to avoid virus transmission, or not something which is tangible of significance. So the point is to see whether it is necessary to implement a measure that would significantly damage the economics of the industry and the possibility for passengers to travel in good condition without bringing an additional safety improvement. And so that's the point. Is it a necessary measure, considering what the damage is and the fact that it doesn't bring significant improvement in safety?
Okay. Thank you, Alexandre. We have a question about contact tracing apps. Do we see a role for these in getting airlines back up and flying? And could such apps be mandatory requirements for entering some countries?
I'll just have a crack at that one. I think this is one of the first points I made, is that one question is the safety of the flight itself, but the other question, very important, is if you're flying from one country to another, then how does the receiving country protect itself against potential importation of cases? And that's where this question becomes important. So I think it's a certainty that the receiving countries will want to have a reliable mechanism for contact tracing for anybody that's entering their country. And whether that is best done with an app or a combination of apps or by other methods will be for those countries to decide. But no doubt the ability to have reliable contact tracing for new arrivals will be part of the picture.
Okay. Brian, we have a clarification on your presentation. Your suggestion is that airfares will initially drop and then shoot up after. And any idea on the time frame for that?
Initially, I think it's inevitable that with demand weak, overcapacity, low fuel prices, low fares, but with if because of operating restrictions like removing the middle seat, the cost of providing services is higher. Eventually, airlines will have to reflect that in fares to operate, to have viable operations. But they'll only be able to pass those costs on in a normal competitive market when demand is back to significantly stronger levels. So it really depends on the strength of the recovery, and that's probably 2021 by the earliest. I would guesstimate.
Okay, thank you, Brian. We have a question on air conditioning. An airline chief executive from Logan Air has suggested that social distancing on board aircraft is impossible because of the air conditioning systems recycling air in the cabin, and that defeats the purpose of social distancing. Do we have any comment on that?
Yeah, so all modern Western jet airliners that use recirculation put the recirculated air through HEPA filters, same grade and type as we use in operating theatres. So the recycled air that's entering the cabin air supply is not an issue. The only exceptions to that would be some very old generation aircraft and some certain categories of turboprop aircraft that use recirculation without HEPA filtration. But you may be aware that in Europe recently the advice went out to airlines to refrain from using recirculation in those type of aircraft if they don't have HEPA filtration. So essentially the answer is that the air supply that's entering the cabin is not a problem. The problem is the direct droplet spread from one passenger to another, and that's the issue that we're trying to discuss mitigating. And maybe I could just, with regard to the middle seat, add one small thing there, that nobody has demonstrated that having the middle seat empty reduces the chance of transmitting COVID-19 from one person to another. And the distance actually is 34 inches, so it's still within the what's regarded as the respiratory zone. So just make that point as well.
Okay, we're running out of time rapidly here. There are a few questions in the queue. Where we have identified questioners, we'll try and get back to you with answers. But I see just a few of the questions that probably need some clarification. So first is to say that indeed we are not recommending that the middle seat should be open, so make sure that that's clear. Because we are recommending a series of layered measures throughout the passenger process that would provide greater protection to passengers. The second is that Brian's figures on a 62% load factor are hypothetical if we were required to do social distancing on aircraft. So far, there is no requirement as such. This was only trying to illustrate what might happen should that eventually come. Brian or David, did you want to make any additional comments to those?
No, I think that's covered it, Tony.
Okay. David?
Yeah, nothing to add, Tony. That's great.
Okay. Well, thank you all very much for joining. It's just after 3 p.m. here in Geneva, so that's the little bit past the time we were scheduled to end. As I said, there are a few questions left in the queue, so we will get back to you individually where we know who you are.